Hi, everyone, and welcome to TheraWin Tales, your one stop shop for exploring the beauty of culture and well being. I am Sakshi Verma, and we have weaved together heartwarming stories and expert advice to help you on a journey to well being. So, today we have with us Geetanjali Vij, who is a professional clinical therapist. So, hi, Geetanjali, how are you doing today?
Hi, Sakshi. I'm doing well. Thank you for having me here.
Thank you for joining us today, and we're really excited to talk to you.
Yes, as am I. I mean, it's a really important topic.
Thank you. So, Gitanjali, can you tell us about yourself, your experiences, your journey?
Yeah, absolutely. So I am a 1.5 generation Punjabi American. So for those who don't
Mhm.
know, that means that I immigrated myself, but I was too small to remember anything from my homeland. And so I'm
Mhm.
not first generation, not second generation, a 1.5 generation Punjabi American. I
Uh-huh.
belong to a family that migrated on a family basis, not on a work basis. And I think that's really important, especially when we think about the Indian population within California, because when they immigrated makes a very big difference to different cultural contexts and where they come from. So I have been living in the Bay Area for many, many years. I am have always been committed to general wellness, mental health before we even truly started talking about it and had the context. And so to that effect, have been for mental health, for well-being and wellness, much
Mhm.
longer than I've been in the mental health profession,
Mhm.
because that's always something that was that big question mark, and I always wanted to think about why and what we do, and so I was always an inquisitive child.
Right.
I went to UC Davis for my undergraduate studies, studied
Mhm.
South Asian and Middle Eastern culture, religious
Mhm.
studies. Have always kind of had that curiosity, and wanted to think about how we function as a society.
Mhm.
And so now I am in therapy, and I work with clients day in and day out, of various backgrounds throughout California.
Mhm. Thank you so much for sharing that. I think you've had very, great experience when it comes to culturally competent mental health when we talk about. So, Gitanjali, what moved you to focus on immigrants? And what do you see? What are the struggles that moved you to focus on this area of mental health?
Yeah, absolutely. I mean, so I think it's important to recognize that I never made a conscious choice to focus on immigrants specifically.
Uh-huh.
I think my aim in my work was always to provide culturally competent and accessible care, whether
Right.
it was any sort of roles I had before or my formal practice as a therapist. And I focused, or I'm able to work with the immigrant population because I am the immigrant population, right?
Right.
My family immigrated in the 80s and 90s.
Mhm.
And it's important to contextualize that because that was the time where you wrote letters home. You
Yeah.
made calls on calling cards.
Hmm.
Very different than the access to, being able to record a podcast across the world at a moment's notice. And so that framework meant that you held community really closely together. You leaned on each other much more, not
Hmm.
just each other in terms of family and people of your culture. I had a very diverse background. I'll give you an example. My parents, my family, in the 80s and 90s, when you saw another person who looked remotely brown, right,
Hmm.
remotely anything, you gravitated towards them, right?
Right.
So it didn't matter if they spoke the same language, if they were Indian or, Bangladeshi or Pakistani or
Hmm.
Nepali, you were just excited that it was someone,
Somebody.
Desi or from the homeland or South Asian. There's different, words people
Right.
use. But now, because there's so much variability and there's so much difference, there's all of these sub communities, right? And so I do think that my philosophy in my clinical approach, in my approach to my profession, comes from that attitude of the collectivist approach to bringing communities together and making sure people feel supported.
Mhm. Yeah, I think that's really important, bringing everybody together and focusing on one thing that is really necessary, that is mental health. So, Gitanjali, since you said that you have migrated to US when you were, I think, 2 years old, 2 or 3?
That's
Yeah,
correct.
right. So, what changes do you see in your whole journey right now when we talk about in 2024? How has mental health changed when we talk about it there and now, especially in culturally context?
Well, I mean, I can talk about this in, for hours and hours. This has been something that I've been touching on my entire career. The reality is the field of mental health and psychology has been evolving so much, has been changing so much without even considering the cultural context, right? That
Right.
when you add that factor and you add, just as with everything else, how globalized the world
Mm-hmm.
has become, it's really important to recognize the ways both in which now therapy and the therapeutic field is inclusive
Hmm.
to people who either don't speak English or are not from Western cultures, but
Yeah.
also to recognize that there's a stigma, right? Because there was
True.
a time where there was not an understanding towards someone who came from a different culture or someone who
Hmm.
wasn't able to speak that language. It was
Yeah.
inaccessible, and not just inaccessible, it was something that was kept off limits, right?
Hmm.
Um,
Right.
the way you grieve, right? The way you heal, that is all highly contextual. It's highly dependent on your family, your ethnic background. And if
Hmm.
that didn't fit into the specific mold of what we used to know as therapy back in the day,
Hmm.
then that was considered as atypical and considered disordered, right? So ostracization was a big part of culture in general that has changed with globalization. And so to
Hmm.
that effect, therapy is a field which I can't even say is the same now than it was a year or two ago, right? There is so much new research, there is so much new technology, new companies, such as this company, that are trying their best to bring equity, to bring a voice to those who need the care, right? That all of that is changing the makeup of the field.
True. Yeah, definitely. It is changing. You're definitely right in this. Now, when we talk about mental health, and if we talk to our parents about mental health, they would say that it's a luxury to, you know, have been thinking about it. Because when we talk about all these cultures, all these, say, India, somebody who has migrated to US from India, they're so much more focused on surviving there that they really don't think about their mental health that much. So it takes a backstage of their life. And it's really great that now we're talking about it and the cultural context as well of it.
No, absolutely. There is a concept called cultural humility, right? That
Mhm.
is really important when practicing therapy with anyone, right? But it is
Mhm.
something that you really have to build that muscle for when you're working with diverse populations, right? I
Mhm.
cannot assume that by someone telling me the age, the ethnic background, the language spoken, the
Yeah.
city that someone comes from in India, that I know their journey, that I know their experience, that I know how their family or their society perceives mental health, how they perceive
Mhm.
mental health, right?
Yeah.
The country itself is so multifaceted that it's it's very counterintuitive from a therapeutic perspective to say, hey, here's a one size fits all, right? Here's
Mhm.
what's going to work for every immigrant from every
Mhm.
country or every single person who comes from India, right?
Mhm.
In the context of providing quality care, groundwork is extremely important, right? That cultural humility piece, walking into the conversation, not allowing yourself to assume anything about the person, right? So
Right.
I'm not assuming just because Sakshi is from Delhi that I know the type of socioeconomic status, the type of familial background, the type of social background that you come from, right?
Yeah.
We're not even talking about individual factors. Are you the oldest or the youngest? Are you an only child? Have you had any adverse experiences? Have you had any trauma? That is the real crux of individual therapy, right? But
Mhm.
before we even get there, when we talk about the cultural context, that cultural competency piece, in really saying you don't know anything, right? So being a clean slate, being able to have the person tell you what they want and what they want from you and how they want it. We are here, we are talking in a conversational manner. You're slipping in and out of Hindi, and I'm slipping in and out of Hindi, right?
Yeah.
in a therapeutic space, it's
Mm.
really important that I don't assume, oh, because this person is from here, they will be more comfortable if I speak Hindi with them.
Hindi.
Or
Mm.
because they are from Delhi, then I'm going to assume that they carry the same values that someone I know from Delhi carries, right?
Yeah.
So that bias is extremely important to keep in check. And
Hmm.
it's even more important when it comes to the context of someone who carries a background that identifies them by their name, by their
Mm.
gender, by all sorts of different things, um, before their immigration status, right? That defines. You don't want to use that to assume anything about the person, and you want to give them as open of a space and non-judgmental of a space as possible. And so, while that happens across the board for patients in therapy, anyways, it is much more acute and much more subtle when it comes to serving any diverse populations.
Okay. Hmm. Yeah, understood. That is really informational. I'm sure that I didn't know about it, that one packet doesn't definitely fit for all. And we have to think broadly when we talk about people coming from different cultures, right? So, Gitanjali, since you've talked to a lot of people like this, what are the major struggles that they face?
It really depends on which. I think the biggest distinction I see is age, right?
Age.
Is someone coming here as a parent in their retirement age and they're migrating on a visa, on a family visa basis, right? So they're coming
Mhm.
here to be reunified with their family. There's a question of competency in English,
Yeah.
right? Do they know English? Do they not know English? That's the first piece of things. Outside of that, you can't assume that they don't know, because oftentimes people speak fluent English. I mean, India is a country where, even, there's other countries where you go where the even the highest educated person is still going to be reluctant to speak English because they're going to say you
Yeah.
speak our language, right? Whereas with India, it doesn't matter how educated, what background someone's from, there's a fundamental knowledge of basic English words. Please, thank you, yes, okay, right?
Right.
And so to that effect, everyone has a different comfortability with English as a language. And again, I can't assume that just because I speak the language someone speaks, they're automatically going to prefer that. And I realized earlier on in my career, in my the undergraduate experience, that for myself, I think when I think of work in
Mhm.
English, but when I think emotionally, when my internal voice is in Punjabi, right?
Yeah.
So I get to make that distinction.
Mm.
Is that differentiation is not going to be the same for everyone, right?
Mm.
And so to that effect, when you're talking to someone, when you're taking in what they're sharing about themselves, what their struggles have been, where they are coming from,
Mhm.
being able to ask and be very flexible for
Mm.
the person is really important. Language as a not just as a linguistic barrier, but as a comfort factor, right?
Right.
Is it enough for you just to have someone in front of you who has a Indian looking face or an Indian name? Do they
Mm.
have to speak the language you speak? Do they have
Mm.
to understand the cultural context? All of these things are very intimate questions that everybody's going to answer differently. The other piece of this is in terms of how you approach establishing care with this person beyond language is
Mm.
also assessing for, what are their clinical needs. Someone who has spent a lifetime of ostracization by family because of a traumatic incident or because of a history of sexual assault is
Mm.
going to not want to be with an Indian clinician because it reminds them too much and it elicits shame or it makes them feel overwhelmed, right?
Right.
Someone else might want an Indian clinician because it would provide a corrective experience.
Mhm.
Someone could have immigrated here for a master's degree or an undergraduate degree or as a high school student and been bullied by someone who was, of any ethnic background. And that reminiscing of it, I know people of color who have been bullied by people of color, people from their own communities, people who've been bullied by in the racist context by other white students, and that is all going to play into if they can establish that comfort with you or not. And so to not take it personally and give them what they need, which sometimes
Mhm.
means if you're not the right fit or they're not comfortable with you, finding them the right fit. All of these are barriers.
Right. That's true. Okay. So, Gitanjali, since we're talking a lot about, like culture and mental health, so are there any practices that therapists follow that are coming from these cultures, say India or Japan? Do you follow any core practices from the taken from these cultures?
I think my choice to go into
Mhm.
therapy as a profession comes from a very, very personal philosophy.
Mhm.
I grew up in a joint family system,
Mhm.
South Asian joint family system. So the collectivist mentality that Indian cultures or Eastern cultures encourage, internalized the ability to think beyond myself, right? The
Mhm.
ability to think about the greater good, the ability to think about a concept of seva, right? Which is as a Sikh concept.
Mhm.
In being Punjabi and the way my family is, we have both Hindu and Sikh and arguably Muslim, influences in terms of culture and values. And so the idea of being in a collectivist family and this
Mhm.
idea of seva, right?
Mhm.
And there's not even a good translation of it, but the idea that you do good not because you're trying to do community service and get brownie points for it or get something in return, but the
Mhm.
fact that your moral duty as a human being is to be able to do
So,
some part of serving your community, and seva is not just about community service or
mhm.
serving strangers or about doing seva, meaning cleaning up your gully, right? Seva
Mhm.
also means taking care of your parents, taking care of your
Yeah.
grandparents, right?
Mhm.
Serving someone when they're sick. So that
Mhm.
kind of selfless love, selfless act of kindness and care is
Mhm.
something that is very Eastern. It is, American culture is very individualistic. Unfortunately, with the way that life is structured here, you're very isolated. You live
Mhm.
independently, you have your own space, which is great for some, but it's also extremely isolating. And
Right.
so, in that way, being able to come together, that's why there's individual therapy, there's therapeutic groups, there are, different modalities of therapy that
Mhm.
emphasize that as social beings, we're
Mhm.
not meant to be isolated, and we're not meant to be um, functioning as in a silo. We're meant to be connected to others. We're meant to give and take in that way. And
Mhm.
so if you think about it that way, collectivist societies have the right idea, because collectivist versus individualistic, well,
Mhm.
collectivist actually goes more towards what is a healthy, sustainable life. And of course, the reality is it has to be a balance of both,
Balance.
right?
Yeah.
Because sometimes if you go too far into the collectivist, then
Mhm.
you're not allowing the person to have their individual identity. And
Right.
so walking that path, you can't go in either extreme, right?
Mhm.
Because there is a need to have community, and there's also a need to have your individual identity and journey.
Mhm.
There's and then another really important thing, which as a trauma survivor, for myself, a very, very life changing concept, despite these things that I shared, is this Japanese concept called, probably going to pronounce it wrong with a name like Gitanjali, apologize in advance. It's this concept called kintsugi. And kintsugi is the literal translation in Japanese is join with goal. Okay. And it's this idea that this is artwork. It's artistic approach
Mhm.
where when a ceramic dish or pot is broken, right? You don't discard it, you don't throw it away.
Yeah.
What they do in that is that they actually piece it together and they
Mhm.
fill in the crevices with a kind of a gold shimmery material, right?
Mhm.
Which fuses it together and holds it back together again. And that process of breaking something to fill in the crevices with something beautiful and accenting it, right?
Yeah.
To then make it whole again, right? for myself and my trauma journey, and for my patients as well, is really transformative to think about how we hold ourselves and how we think of the concept of being hurt or broken,
Yeah.
and how we come back from that,
Hmm.
right?
Right.
Finding strength in those really deep, broken moments
Hmm.
is part of the essence of therapeutic work, right?
Right.
Um,
Yeah.
and changing that narrative. And so that particular concept for me really allowed me to kind of unlock that grief of, hey, if something is happening with you or something, and this
Hmm.
is a huge thing for people, stigma, right?
Hmm.
As soon as you tell someone's seeing a therapist, they say, what's wrong with them? Right?
Yeah.
What's wrong with
Mhm.
you? Oh, mom, I'm depressed. Oh, what's wrong with you?
Yeah.
Dad, I feel anxious when you do this thing. Well, what's wrong with you? Why can't you take it?
Mm.
Like there's immediately this idea that if you're expressing a need that is different than normal, that there's something wrong with you. And
Yeah.
so, whether Western or Eastern cultures, when you feel that pressure and you feel that shame, being able to find a concept like this really helps you flip the narrative,
Mm.
right? And
Right.
be able to see yourself as something strong and resilient and a better version of yourself despite that break.
Yeah, right. That's true. And it's a beautiful concept, right? We see that if something, I think it teaches us that when something is, broken, or if we're struggling with something, it can always be fixed with how much care, how much love you pour into yourself, right? And I think we should all see therapy or mental health as like this only. It's about taking care of yourself. It doesn't have to be that what's wrong with me every single time, right?
Hmm.
Yeah.
And
Mhm.
that's a really really important thing to bring up,
Yeah.
because it shifts the lens, right? You're
Mm.
100% right. That idea of, if I go, someone's going to think that there's something wrong with me, or kind of admitting this is going to mean that I'm not just, we as South Asians culturally
Mm.
really pride themselves. They wear, their strengths and their weaknesses on their sleeve, right? So
Mm.
they really pride themselves on resilience and, hey, I had a headache, but I didn't take the medicine, right?
Medicine.
I
Yeah.
toughed it out,
Mm.
without realizing that the impact that ultimately has on your system is probably
Mm.
more damaging, right?
Mhm.
So there is this kind of denial or stigma, whatever you want to call it. But in that way, what happens is the approach is then, I am being diagnosed with this, and
Mm.
it's like terminal diagnosis. So
Right.
so there's this idea that, like, if someone's telling me that there's something wrong with me, right?
Mm.
They're saying,
Mm. Yeah.
right, and it's either sane or insane.
Insane.
And
Yeah.
I can't accept that I'm insane, right?
Mm.
Whereas the reality of talk therapy and the reality of mental health is, we all have health, we all have health problems.
Problems.
We
Yeah.
all have mental health. We all have mental health problems, right? For
Right.
some, it's a small thing. It's within their body's ability to maintain it, like their immune system, right? They
Mm.
might get a cold, it goes to the symptom. But somebody
Mhm.
who's immunocompromised, or someone
Mhm.
who, is not able to process something the same way, not going
Mhm.
to recover and bounce back as quickly, right?
Right.
And so we have a long way to go until we start seeing going to therapy as, not as, hey, there's something wrong with me,
Mm.
or that it's black and white, but recognizing that as we move through life, we have things that make us happy and we have things that
Mhm.
make us sad, right? The thing that will make your therapist the happiest is that they stop seeing you,
Mm. Right.
right? Just like your doctor, your therapist does not want to hear from you. They want
Mhm.
to know that they were able to help you, you were able to build that resilience, and you're able to move forward, right?
Yeah.
So there's this idea of, like, the person's going to get me trapped in appointments and medications and this, that, and whatever, right? Well, that's contraindicated to the goal that a therapist has. The whole
Mm.
idea is that you don't need that, hopefully at the end of the day, you don't need me.
Mhm.
Yeah.
Right. Yeah. I think it's really important for us to see mental health as a spectrum rather than, like just 2 points that either you're sane or you're insane. And as Indians, we really fail to realize this and also come forward and express our vulnerabilities. Gitanjali, what do you think? Why, when we talk about people that are coming from these cultures, they're very reluctant to share their vulnerabilities?
I think it's a very, very loaded question. Vulnerability is not seen as strength.
Mm,
Vulnerability is seen as weakness.
right.
And across the board, I think this is not specific to one community or one. Uh,
Mhm.
both in Western and Eastern cultures, arguably where you're taking more of a patriarchal approach, which is quite common around the world, right?
Yeah.
The feminine, the soft, the
Mm,
emotional, the vulnerable
mhm.
is not seen as strong. It's seen as weak, right?
Yeah.
And
Mm,
until you acknowledge that, you're not able to truly engage in this space and or engage in any sort of care, right?
mm,
And I think about my background and the people that I was raised by, right? My grandfather was born in 1940. Okay. He was the most vulnerable and open and sensitive man I have met till date.
mm,
I have not met anyone born years after him in more progressive, more um, educated, more urban, more worldly, whatever you want to call it, whatever people
yeah.
equate with being feminist, right? He was a feminist. He grew up in a small town,
Mm,
arguably a village in Punjab, right?
yeah.
So there's this idea of dichotomies we set up, right?
Mm,
Strong versus weak, rich versus poor, from
mm,
being from the city versus being from the village, being
mm,
educated versus uneducated. All of these things we set up schemas, right? So with gender, the West has a very gender binary approach, right?
mm,
That it's A, B, that's it, right?
yeah.
But if you look at Indian literature, Indian history, Indian cultural mythology, Indian even kind of the ways that gods and historical figures are described,
Yeah.
right? There's very little difference in how, like Krishnji is called Sham Sundar, right?
Sundari.
A
Right.
woman will also be called Sundar, right?
Mm,
In that case.
mhm,
Today, I don't know about you, but if I walk up to an Indian guy and I call him
mm,
Sundar, he's
mm,
going to say it's going to take offense to that, right? It's going
yeah.
to land, it's not going to land in the way that you mean it.
Right.
And that kind of like boomerang effect of viewing the South Asian, the Hindu, the Indian, whatever you want to call it,
Mhm,
through a Western lens and
mhm,
imposing a binary on it to things such as gender, to gender roles, to gender
mhm,
norms, right?
mhm,
That is something that is the first hurdle for someone themselves to approach therapy, for someone to go up to a family member and say, hey, I'm not feeling good about this. I want to talk about this, or I need support with this. And
mhm.
certainly something that is unlearning those things is a big part of what my work with clients is from the get
Yeah.
go.
Do we see any differences in the way that a woman approaches therapy and a man, comes forward and says that, yeah, we need therapy? And typically, if you talk about mental health in both of these, genders or other genders, how do they differ?
Cool. So I don't think it's fair to speak to everyone's narrative and make a blanket statement, but
Hmm.
I will share my journey and my experience. Okay.
Okay.
As I mentioned, there is a cultural concept in anthropology where, when someone immigrates,
Mm,
what they take with them, sometimes they grow with their home country, but
mm,
especially for older folks and when times where there was such a divide in the country, the world was not as globalized. There's this way in which you kind of freeze the home culture, the home community in a way of preserving your history, right? You kind of still think that the town you left, the city you left, the house you left, when you leave your home, right? When you leave your home and you go on vacation, you're thinking about how everything is set up because it's a sense of familiarity, it's a sense of comfort, right? And then when you come back, sometimes, students leave for college and then their parents change their rooms to a gym, right? That hurts. Why? Because that comfort, that loss is there. So for myself,
Mm-hmm.
um, as a woman in a
Mm-hmm.
family where there was a lot of patriarchal norms, a lot of cultural perspectives that didn't change with the times because
Mm-hmm.
of when my family immigrated, that you did have to push up against them. I was the oldest of three girls, right? So the first thing is you would go to any gurdwara or mandir, and
Mm-hmm.
some would come up to one of my parents and
Mm-hmm.
say, "You have three daughters. You should try for a son, right?" Or,
Yeah.
"Oh," they tell us, right? Like,
Mm-hmm.
"Hey, pray that you have a brother," right? So
Mm-hmm.
there, it was never something that is overtly said, but it comes out in these ways, in
Yeah.
different ways. I have to hand it to my parents, being the parents of three daughters, being who they were, the context and the background that they came from. There has been no one who has been more empowering and has done more work than I have seen my parents do.
Yeah.
When someone came up to them and made a comment of that nature, they
Yeah.
didn't flinch. I didn't even see them have one moment of like, yeah, that person's right. Never, right?
Yeah.
And that really empowered me as a woman to not just express myself, but to be able to do so unapologetically. Hypermasculinity and patriarchy is arguably more dangerous for Indian men than it is for Indian women, right?
True.
Because, Indian women, that struggle is identified, right? If I'm crying, no one's telling me, be a man, don't cry, right?
Yeah.
It is equally confusing to be a South Asian man as it is a South Asian woman, because in both cases, your gender identity is a box. It's fixed, right? You are female. You are supposed to have long hair. You're supposed to know how to cook. You're supposed to do XYZ. You're
Mm-hmm.
male. You're not, Tamasha. I cannot say enough about Tamasha, the movie. Okay.
Mm-hmm.
Tamasha, the movie, is a great example of how patriarchal systems, of how societal norms and expectations put equal amounts of pressure. The person who was more disturbed, the person who was more uncomfortable in their skin in that movie was the male protagonist,
Right.
right? Because they wanted to be artistic. They didn't want to have to worry about being educated and being the breadwinner and all of that. So when I say I take a feminist approach to my therapeutic care, that's not saying I take a feminist approach only for those who identify as feminine, but that I take an approach to identifying gender norms across the board. Gender binaries are all things that hinder your ability to be yourself, regardless of what that identity is in the cultural context as it exists today.
Yeah, right. It it's a really great topic to talk about, that how feminism, right? We are not just doing that for ourselves, right? We're doing that for our coming generation, for our coming boys, for our coming girls as well. And it's a important topic that you put forward, that how mental health is, and maintaining that masculine image of yourself is actually harming themselves, right? So I get reminded of this one thing, right? We all say that our mothers have a lot of friends, as women we have, but I just can't stop thinking about that, how many friends my dad has like that, that who he can approach and share that, hey, I'm dealing with this thing, and will you back up me if I go for support?
Yeah,
Right.
and this comes up, very, very clearly when you think of the social context, right? Whether it's siblings or friends. Unfortunately, this is a phenomena that I've seen both professionally and just in my experience with this community. In the South Asian community specifically, there are so many instances where a man's best friend, if not only female friend, is
Mm.
their partner, right?
Right.
And there's, again, back to my Bollywood roots, like there's the kuch kuch hota hai pyar dosti hai vibe, right?
Yeah.
Yes, you want friendship. Yes, you want vulnerability. Yes, you want
Mhm.
mutual care in a relationship, right?
Mhm.
But everyone is, it's not one size fits all, right?
Mm,
For some people, yeah, their partner may be their best friend and their partner, and that's totally okay, right?
mhm,
Everyone has a different cup of tea. But the leaning on the female partner, and the
mhm.
female partner kind of carrying the emotional weight in the
Right.
relationship, is
Mm,
something that is a lot higher, a lot more common in
mhm.
South Asian, younger South Asian couples, and older South Asian couples for that matter too, than it is in other, across other communities. And a big part of that is, well, hey, I who do I reach out to get my needs met? Well, as a young Indian boy, I have a good
Yeah.
relationship with my mom. I'm afraid of my dad. I don't really have any other, I don't have a sister. I don't have any other influences. I've been told to stay away from girls because God forbid I be walking home from school with a girl next to me and someone's going to say something's happening there, right? So that
Right.
idea of like community and perception is really toxic, right?
Mhm.
And so then finally you get married and it's like, all right, hey, you're my person. Here you go, right?
Yeah.
Um,
Yeah. Right, right. And I feel it really takes a huge toll on a woman, right? When they're in a relationship or they're married, and especially in South Asian, because all the responsibility is like yours, you have to take care of your own mental health, your partner's mental health, your in-laws' mental health, and everything. Everybody
mhm,
is
mhm.
coming up. Say our example of our mothers, right? Everybody is
It's
in our
normalized.
family. Yeah, it's normalized. It's like,
It's normalized.
yeah, whenever something happens, you always run to your mom. And
Yeah.
I think that shouldn't be just her task to do, right? We should
Mm,
have other significant people in our life, and we should reach out to more people for that sake.
yeah.
Yeah.
There's a visual resource. It's, I don't want to call it a comic strip. It's like it's told in narrative form with illustrations. It's excellent.
Mhm.
Very easy to consume as a piece instead of heavy clinical language. There's this
Mhm.
piece that's called the mental load. Right. So if you
Mhm.
Google the mental load, I don't know who it's by. You might have to insert their name here.
Mhm.
But it is a very, very digestible, very, very clear look at the concept, the exact concept as you're naming, right? What happens when the expectation and that weight is disproportionate
Mhm.
in that dynamic as a husband and a wife. Grew up in a home where my nanny was the first person in her bloodline to hold a job outside of the home, right? She was a full-time mom and a full-time teacher, right? She retired as a principal.
Mhm.
After that, my mom and my dad
Yeah.
completely full-time, making ends meet here as immigrants, and whatever needed to be done, they did it together, right? My dad, we were three sisters. So there was not this gendered concept of, this is a Western thing, it's an American thing. I don't know if this is in other places, but like taking the trash out was seen as like a masculine, like the brother's task, right?
Yeah.
And my sister was taking the trash out once, and someone said, "Wow, like you're the man of the house, you're taking the trash out." And we realized that
Mhm.
because we grew up as three girls and our
Mhm.
dad never said, I'm going to do this, I'm not going to do this, that we never inherited, we never ingested that, right?
Right.
So we didn't see changing a tire or cleaning the car or grabbing a hammer and fixing the fence as, oh, I won't do that, my brother will do that, or my dad will do that. And that's not just a South Asian thing, that's across the board, right?
Right.
The division of labor in that way. And that is, it's every single family, every single couple is kind of coming up against that differently.
Mhm.
My own partner, right? I enjoy cooking, right? I cook, I play holy in the kitchen, as my partner likes to say, and he does the dishes, right? He
Mhm.
does the cleaning, he does the dishes. He is more, they say like, oh, women are more clean, women keep the house cleaner than
Yeah.
men, right? In my experience, that's not the case. Now, when someone
Mhm.
comes over, when someone sees things, they might comment on it, right? But
Yeah.
there's no concept here of this is a masculine task versus a feminine task. And
Mhm.
that is culturally there, yes.
Hmm.
but it comes down to a very into at the end of the day, it comes down to a choice, right?
Right.
It comes down to an understanding, and that is something that we have to make. We have to make that change, for lack of better
Hmm.
words,
Hmm.
on a case basis.
Yeah. Right. So I think we're having a very, deep loaded conversation about mental health here. So just to lighten
We've
up
gone
the
off the deep end here.
we've gone up, exactly. Yeah. So just to bring back the track and make it a bit lighter.
Sure.
So have you experienced any, cultural quirks that people talk about mental health? Something funny, cultural quirks.
Probably my favorite thing about working with people who are culturally more Desi or culturally more Indian, regardless of when they've come or have not come from India, is they are able to laugh at themselves a lot more easily, right?
Yeah.
Like there is
Yeah.
a much bigger role that humor plays,
Hmm.
right? Like, how are you feeling? Well, I'm not feeling good, am I? If I was feeling good, why would I be here? Right?
Mm. Yeah.
Or, you know, being able to say, like, yeah, like I did that thing because, that's just me, right? So there's a little bit more honesty and vulnerability through humor
Mhm.
that comes
Mhm.
up when you have folks who are culturally not as westernized.
Hmm.
The way
Right.
that they think about themselves, the family
Mhm.
that they are in, the culture and the community that they are in. When it's less Western,
Mhm.
there's more of an ability to speak candidly and laugh and connect about your circumstances.
Yeah.
And that vulnerability is a very important and utilizable tool in therapy.
Mhm. So I think that's what a quality that Indians have. They have a thing about lightening every situation, be it, whatever tense that it is. Yeah. Okay. So it's really great talking to you, Gitanjali, and we learned a lot about mental health, about culture, about gender, and we gained a lot of knowledge, a lot of confidence in the context that we are talking about. So thank you so much for being with us here today. Thank you.
Yeah, no, absolutely. The pleasure is mine. It's continue to do the great work that you're doing and continue to have these conversations.
Thank you.